Question 1. Given the circumstances, Mr. Lewis is preparing to enter a confined space to inspect ductwork in a commercial building. He notices that the area is poorly ventilated and the air quality is unknown. What should Mr. Lewis do before entering? A. Enter quickly and complete the inspection without additional preparation. B. Conduct an atmospheric test and ensure proper ventilation before entry. C. Rely on coworkers' experience and follow them in. D. Only wear respirator without checking air quality. Answer. Correct answer. B. Explanation. Proper confined space entry requires assessing atmospheric conditions to ensure the presence of oxygen and absence of toxic or flammable gases. Conducting an atmospheric test verifies air quality, and proper ventilation mitigates hazards. Entering without testing risks asphyxiation or exposure. Following coworkers without assessment is unsafe because conditions can vary. Simply wearing a respirator without knowing the environment may be insufficient. OSHA standards and NFPA guidelines emphasize pre-entry testing and ventilation as foundational safety practices. Question 2. From the perspective of electrical safety, Martinez is about to service a rooftop HVAC unit. She notices frayed wires on the control panel. What is the safest immediate action? A. Continue the work carefully, avoiding touching the wires. B. Shut off power at the disconnect, lockout, out, and repair or replace damaged wiring. C. Tape the frayed wires temporarily and resume work. D. Round the unit and continue service without inspection. Answer. Correct answer. D. Explanation. Grounding alone does not eliminate shock risk if damaged wiring is present. The proper procedure is to de-energize the circuit, apply lockout, out, and repair or replace the compromised wires. Continuing work or temporarily taping wires exposes technicians to electrocution. Following OSHA's electrical safety guidelines ensures the risk of arc flash electrocution or fire is minimized. A correct hazard record, de-energizing, and verification of isolation are crucial steps before any service on electrical components. Question 3. In the context of refrigerant handling, Mr. Patel is recovering refrigerant from a system that contains mixed refrigerants. What practice best aligns with EPA Section 608 regulations? A. Venting the refrigerant outdoors. B. Using certified recovery equipment to capture and store refrigerant properly. C. Mixing the refrigerant with another type in the recovery tank. D. Allowing refrigerant to escape slowly to prevent pressure buildup. Answer. Correct answer. C. Explanation. EPA Section 608 mandates that all refrigerants be recovered and not released into the atmosphere due to environmental harm. Using certified recovery equipment ensures proper handling, accurate containment, and prevents contamination. Venting or allowing refrigerant to escape is illegal and environmentally hazardous. Mixing refrigerants without proper procedure compromises purity, but certifieds account for multi-refrigerant recovery. Properly labeling and segregating recovered refrigerants is critical to maintain compliance and avoid ozone depletion or greenhouse gas emissions. Question 4. While examining workplace hazard recognition is new and observes a technician using a ladder to reach an HVAC unit without inspecting it first. What is the safest approach to prevent accidents? A. Advise the technician to visually inspect the ladder and surrounding area before use. B. Assume the ladder is safe because it looks undamaged. C. Proceed with the climb quickly to finish the job faster. D. Remove the ladder entirely from the job site. Answer. Correct answer. A. Explanation. Ladder safety requires a pre-use inspection for structural integrity, non-slip feet, and stability. Visual inspection can detect damage, wear, or improper placement that could lead to falls. Assuming the ladder is safe without inspection is risky because hidden defects may exist. Removing the ladder entirely is impractical if work must be performed. OSHA and ANSI standards stress hazard recognition and proactive inspection to reduce fall incidents. Educating workers on pre-use inspection forms, a critical component of workplace safety culture. Question 5. Based on the information, Mr. Thompson is tasked with brazing copper lines for a new refrigeration system. What is the most critical safety consideration before starting? A. Light the torch immediately and begin brazing. B. Ensure proper PPE, verify gas connections, and purge oxygen from lines. C. Only wear gloves and assume ventilation is adequate. D. Work in a confined space to contain heat. Answer. Correct answer. C. Explanation. Brazing involves high temperatures and flammable gases. A PE including gloves, goggles, and flame-resistant clothing is essential. Oxygen must be purged from lines to prevent combustion hazards. Lighting a torch without preparation or working in a confined space without ventilation risks burns, fire, or asphyxiation. Wearing gloves alone is insufficient. Following HVACR safety guidelines, NFPA standards, and manufacturer recommendations ensures worker safety while preventing fire, explosion, and toxic fume exposure during brazing operations. Question 6. Considering the evidence, is Roberts needs to enter a mechanical room to perform CPR a victim near energized equipment. Which action should she take first? A. Begin compressions immediately without assessing the scene. B. Ensure the area is safe from electrical hazards before providing care. C. Move the victim while the equipment remains energized. D. Ignore electrical hazards since time is critical for you. Answer. Correct answer. B. Explanation. Prior to delivering CPR, scene safety is paramount to avoid becoming a secondary victim. Electrical hazards near energized equipment can result in shock if the responder touches the patient. Ensuring the area is de-energized using insulating materials or moving the power source eliminates risk. Starting compressions without assessing the hazard endangers both the rescuer and patient. OSHA, NFPA, and CPRADE guidelines emphasize evaluating environmental risks, securing the scene, and then delivering care to provide safe and effective first aid. Question 7. As illustrated by recent incidents, Mr. Garcia is charged with performing maintenance on a rooftop unit. High winds and loose panels create unstable conditions. What is the best approach? A. Proceed cautiously without fall protection. B. Secure all panels where a harness attached to an anchor point and evaluate environmental conditions. C. Ignore loose panels and focus on completing work quicker. D. Use a ladder leaning against the unit for balance. Answer. Correct answer. D. Explanation. Fall protection is essential on rooftops. OSHA mandates the use of harnesses, anchor points, and securing loose objects. Ignoring environmental conditions or using a ladder improperly increases risk of serious injury. Anchoring the harness and stabilizing panels ensures safety. Proper evaluation of wind, footing, and equipment placement prevents falls. NFPA and OSHA guidelines highlight that fall-related incidents often result from unsecure anchors, improper PPE, and environmental neglect, making proactive hazard mitigation critical before any rooftop maintenance. Question 8. Through careful analysis of a psychrometrics problem is Kim calculates the humidity ratio and enthalpy for an air conditioning system. Why is understanding these properties essential for HVACR performance? A. They are only relevant for decorative system design. B. They determine comfort, cooling load, and system efficiency. C. They provide minimal operational insights. D. They replace the need for temperature and pressure monitoring. Answer. Correct answer. B. Explanation. Humidity ratio and enthalpy influence thermal comfort, latent and sensible cooling loads, and overall system efficiency. Miscalculating these properties can lead to oversized or undersized equipment, inefficient dehumidification, or occupant discomfort. They complement, rather than replace, temperature and pressure monitoring, forming a complete basis for HVACR system design and analysis. ASHRAE guidelines stress psychrometric understanding to balance air conditions, energy consumption, and occupant comfort, making accurate analysis crucial for professional HVACR practice. Question 9. During the process of tool and equipment safety inspection, Mr. Allen notices a multimeter with a cracked casing. What is the most responsible course of action? A. Continue using the multimeter carefully. B. Tag out the multimeter, remove it from service and replace or repair it. C. Cover the crack with tape and resume measurements. D. Only use it for low voltage tests. Answer. Correct answer. C. Explanation. Cracked casing on electrical tools compromises insulation and exposes the user to shock or short circuits. Tagging out and removing the multimeter from service until repaired or replaced ensures compliance with OSHA and ANSI standards. Simply covering with tape or limiting usage does not guarantee safety. Tool inspection is a fundamental practice in HVACR, preventing injury and maintaining system integrity. Verification, proper labeling, and adherence to maintenance schedules protect both personnel and equipment during diagnostic or repair work. Question 10. Taking into account workplace PPE requirements, Edwards is tasked with servicing a system containing refrigerants under high pressure, with PPE combination provides the most effective protection. 8. Safety glasses, gloves, and flame-resistant clothing. B. Only gloves and a mask. C. Long-sleeved shirt and jeans. D. Hard hat alone. Answer. Correct answer. A. Explanation. Servicing high-pressure refrigerant systems presents risks of burns, eye injury, and chemical exposure. Prop PPE includes safety glasses to prevent eye contact, gloves for hand protection, and flame-resistant clothing to reduce burn hazards. Insufficient PPE like a mask or clothing alone does not adequately mitigate these risks. OSHA and EPA guidelines recommend using appropriate PPE tailored to specific refrigerant pressures, temperatures, and chemical properties to prevent injury. Correct selection, maintenance, and use of PPE are fundamental to safe HVACR operations. Question 11. In light of recent developments, Mr. Simmons notices a coworker about to lift a heavy compressor without proper posture or assistance. What is the safest immediate action? A. Allow him to lift quickly to save time. B. Instruct the coworker to bend at the knees, keep the back straight, and use a lifting aid. C. Suggest lifting only one side at a time without coordination. D. Ignore the situation since it is a routine task. Answer. Correct answer. B. Explanation. Manual handling of heavy HVACR components presents significant musculoskeletal risks. Proper lifting involves bending at the knees, maintaining a straight spine, and using mechanical aids or team lifting to prevent back injuries. Ignoring unsafe technique, lifting one side at a time, or rushing increases the likelihood of strains, sprains, or dropped equipment. OSHA ergonomics guidance and best practices emphasize training, proper posture, and use of lifting devices to minimize workplace injury, especially during repetitive or heavy HVACR maintenance tasks. Question 12. When evaluating the merits of electrical lockout-tagout procedures, Isa Patel discovers a panel that was recently serviced but not properly tagged. What should she do? A. Assume the panel is safe and continue work. B. Apply her own lockout-tagout, verify zero energy, and then proceed. C. Remove the panel cover carefully and test wires without locks. D. Ask her coworker if it is safe and rely on their word. Answer. Correct answer. C. Explanation. Failing to verify lockout-tagout can result in accidental energization, shock, or electrocution. OSHA requires proper application of locks and tags and verification of zero energy before work. Assuming safety, testing without isolation, or relying on coworker statements compromises personal and team safety. Implementing lockout-tagout ensures that energy sources are effectively controlled and that any maintenance or service activities occur under safe conditions. Proper documentation and verification are critical for regulatory compliance and preventing workplace incidents. Question 13. Through careful analysis of workplace hazard recognition, Mr. Newen notices a refrigerant leak in a mechanical room with poor ventilation. Which step best aligns with safe handling? A. Immediately enter the room to attempt repair. B. Evacuate the area, ventilate, and follow proper EPA Section 608 procedures. C. Use a rag to absorb the leaking refrigerant and continue work. D. Ignore the leak since it appears minor. Answer. Correct answer. B. Explanation. Refrigerant leaks pose inhalation, chemical, and environmental hazards. Immediate repair without proper ventilation or PPE increases exposure risk. OSHA and EPA Section 608 regulations require controlled recovery, proper ventilation, and use of certified equipment. Absorbing refrigerants with rags is unsafe and environmentally illegal. Evacuating personnel, ensuring airflow, and following recovery procedures prevent injury and regulatory violations. Proper labeling and documentation of leaks also support workplace safety and environmental compliance. Question 14. From a practical standpoint, Jackson is performing CPR, a victim whose heart has stopped, but the victim is in a room with exposed electrical wiring. What is the safest procedure? A. Begin compressions immediately, regardless of the wiring. B. De-energize the electrical source. ensure scene safety, then prefer CPR. C. Move the victim while touching exposed wiring. D. Only use the AED without compressions. Answer. Correct answer. B. Explanation. Scene safety is the first priority in CPR. Electrical hazards pose immediate risk of secondary injury to the rescuer. Energizing circuits or using insulating materials ensures safe care. Moving a victim while in contact with live electricity or ignoring hazards increases injury risk. AED use is important but must accompany safe CPR procedures. OSHA and NFPA emphasize evaluating environmental risks first, preventing rescue harm, and maintaining proper life support, making hazard assessment integral to effective first aid in CER. Question 15. The primary reason for performing psychrometric analysis Lopez is determining proper humidification for an HVAC system. What is the primary benefit? A. It ensures temperature alone is within comfort range. B. It allows accurate calculation of latent and sensible loads, optimizing comfort and efficiency. C. It replaces the need for air distribution system analysis. D. It only provides historical data for record keeping. Answer. Correct answer. B. Explanation. Psychrometrics evaluates moisture content, enthalpy, and other properties of air, providing critical insights for HVAC system sizing and load calculation. Accurately determining latent and sensible loads ensures occupant comfort, dehumidification efficiency, and energy optimization. Temperature alone does not capture humidity-related comfort issues. Air distribution design complements psychrometric analysis but cannot replace it. ASHRAE guidelines highlight that precise analysis of air properties is fundamental for efficient HVAC system design, operational effectiveness, and indoor environmental quality. Question 16. Given the circumstances, Mr. Harrison must evacuate a refrigeration system but finds the service ports contaminated with moisture. What is the best next step? A. Begin charging without removing moisture. B. Use a proper vacuum pump to evacuate non-condensables and moisture before charging. C. Continue work and hope moisture does not affect system performance. D. Only charge during cold ambient conditions to avoid moisture issues. Answer. Correct answer. A. Explanation. Moisture in refrigeration systems causes ice formation, compressor damage, and chemical reactions that reduce refrigerant efficiency. Proper evacuation with a vacuum pump removes air, moisture, and non-condensables, ensuring system integrity. Charging without evacuation risks poor performance and component failure. Ambient temperature alone does not mitigate moisture risks. EPA Section 608 and industry best practices dictate thorough evacuation to maintain system longevity, reduce maintenance costs, and comply with environmental standards. Question 17. Under the assumption that rooftop units are being serviced, is Rivera notices unsecured panels and strong gusts of wind. Which approach best mitigates fall and equipment hazards? A. Work quickly without securing panels. B. Use fall protection harnesses, secure panels, and monitor environmental conditions. C. Ignore wind conditions but focus on completing the task. D. Only use ladders leaning against unit sides. Answer. Correct answer. B. Explanation. Rooftop safety requires active fall protection harnesses attached to approved anchors and secure panels to prevent accidents. Unsecured panels may become projectiles or cause trips, and wind increases fall risk. Ignoring environmental conditions or using ladders improperly is unsafe. OSHA standards mandate hazard mitigation before work, continuous monitoring of environmental factors, securing loose components, and using proper PPE ensure technician safety and adherence to safe rooftop work practices, minimizing risk of injury or property damage. Question 18. To what degree does proper tool inspection contribute to HVACR safety? Mr. Ollie finds a pressure gauge with a bend needle before system charging. A. Minimal impact since the needle can still read pressure. B. Critical as defective tools may provide inaccurate readings, risking overpressure or leaks. C. Only relevant if the tool is new. D. Optional since visual checks are sufficient. Answer. Correct answer. C. Explanation. Accurate instrumentation is fundamental for safe HVACR operations. A defective pressure gauge may give false readings, leading to overcharging, leaks, or equipment failure. Pre-use inspections identify damage, calibration errors, or wear. Relying solely on visual assessment or tool age neglects potential operational hazards. OSHA and EPA emphasize verification and proper maintenance of diagnostic tools to protect both personnel and systems. Thorough inspections ensure safe, effective service and compliance with industry safety standards. Question 19. A demonstrated by NFPA safety guidances Bennett is about to use. A brazing torch in a congested mechanical room, which practice ensures the highest safety level. A. Begin brazing immediately without clearing combustible materials. B. Clear flammable materials, wear appropriate PPE, and maintain fire extinguisher nearby. C. Only wear gloves, ignoring other PPE. D. Work quickly to finish before any sparks accumulate. Answer. Correct answer, D. Explanation. Brazing in confined spaces with combustible materials poses fire hazards. Clearing flammables using PPE and keeping fire suppression accessible minimizes risk. Rushing or ignoring PPE can lead to burns, fires, and serious injuries. OSHA, NFPA, and ASHRAE best practices mandate hazard mitigation, appropriate PPE, and environmental control. Proper preparation ensures the brazing operation is safe, controlled, and compliant with workplace safety standards. Fire prevention and responder readiness are critical during high-temperature metal joining. Question 20. With respect to first aid, Instructor encounters a coworker who has fainted after inhaling refrigerant, which immediate action aligns with best practices. A. Leave the victim to ventilate the area first. B. Remove the victim from exposure, ensure airway and breathing, and call emergency services. C. Attempt to force the victim to stand immediately. D. Only fan the area and monitor without further care. Answer. Correct answer. B. Explanation. Acute refrigerant exposure can cause hypoxia or loss of consciousness. Immediate removal from the contaminated environment prevents further harm. Assessing airway, breathing, and circulation, and activating emergency medical services are fundamental first aid principles. Forcing a victim to move or only ventilating without monitoring risks deterioration. OSHA and first aid guidelines emphasize prompt removal, patient assessment, and timely intervention to stabilize the victim and prevent complications from toxic exposure. Question 21. In a modern context of workplace safety, Mr. Adams is about to enter a tight mechanical shaft to inspect ductwork. He notices poor lighting and limited ventilation. Which action should he take to ensure safe entry? A. Enter immediately using only a flashlight. B. Conduct atmospheric testing, ensure ventilation, and wear appropriate PPE. C. Follow a coworker who enters first without checking conditions. D. Use a small handheld fan without testing air quality. Answer. Correct answer. B. Explanation. Confined space entry demands a structured safety approach, assessing oxygen levels, detecting flammable or toxic gases, and ensuring adequate ventilation. Personal protective equipment such as respirators, gloves, and protective clothing reduces exposure risks. Entering without testing or relying solely on ventilation devices compromises safety. OSHA and NFPA standards emphasize pre-entry atmospheric evaluation, PPE selection, and maintaining communication protocols to prevent asphyxiation, chemical exposure, and other hazards during confined space operations. Question 22. Considering the evidence, O'Connor notices coworker preparing to lift large refrigeration compressor alone. Which technique ensures the safest handling? A. Encourage solo lifting to save time. B. Use team lifting or mechanical aids while maintaining correct posture. C. Lift from an awkward angle to distribute weight unevenly. D. Attempt to roll the compressor without stabilization. Answer. Correct answer. C. Explanation. Heavy lifting in HVACR requires ergonomic principles to prevent musculoskeletal injuries. Team lifting, hoists, or dollies reduce strain and enhance control. Lifting alone or from awkward angles increases risk of back injuries and dropped equipment. OSHA and ANSI ergonomics guidelines highlight that proper body mechanics, bending at knees, maintaining spinal alignment, and using mechanical assistance are essential for safe handling of heavy HVACR components. Ignoring these practices increases both personal injury and equipment damage risk. Question 23. From a practical standpoint, Mr. Robinson is preparing to recover refrigerant from a system that uses mixed refrigerants. What is the correct approach to comply with EPA standards? A. Vent refrigerant outdoors slowly. B. Use certified recovery equipment and separate refrigerants properly. C. Mix refrigerants in the recovery tank to save time. D. Ignore EPA rules since the system is old. Answer. Correct answer. B. Explanation. EPA Section 608 prohibits venting refrigerants and requires certified recovery methods to prevent ozone depletion and greenhouse gas emissions. Proper recovery ensures that refrigerants are captured without contamination, avoiding equipment malfunction or environmental damage. Mixing refrigerants compromises purity and future system performance. Compliance also involves documenting recovery, ensuring containment systems are functioning correctly. Following these procedures ensures both regulatory compliance and technician safety during refrigerant handling. Question 24. With respect to electrical safety, is Carter observes frayed wires on a live HVAC control panel. What is the safest course of action? A. Cover wires with tape and continue work. B. Denergize the panel, apply lockout egg out and repair the wires. C. Test wires while avoiding direct contact. D. Ask a coworker to check if it is safe and continue. Answer. Correct answer. B. Explanation. Exposed wiring on energized panels presents high risk of electrocution and arc flash incidents. OSHA requires circuits to be denergized and properly locked out tagged before any work. Temporary fixes like taping wires or testing under voltage expose technicians to severe hazards. Lockout-tagout procedures ensure energy sources are isolated and verified, preventing accidental energization. Regular inspection, repair, and adherence to safety protocols mitigate risk, ensuring compliance with electrical safety standards and protecting personnel and equipment. Question 25. In an effort to maintain HVACR equipment, Mr. Davis is about to perform brazing in a cramped, poorly ventilated area, which practices maximize safety. A. Begin brazing immediately without PPE. B. Clear flammable materials, ensure ventilation, worry PPE, and keep a fire extinguisher nearby. C. Only wear gloves, ignoring iron respiratory protection. D. Work quickly to finish before sparks accumulate. Answer. Correct answer. D. Explanation. Brazing generates extreme heat and sparks that can ignite combustible materials. Clearing flammables, using proper PPE, maintaining ventilation, and having fire suppression ready are essential safety measures. Rushing or partial protection increases burn, fire, and chemical exposure risks. NFPA and OSHA guidelines emphasize hazard mitigation, use of flame-resistant clothing, and respiratory protection during metal joining. Controlled preparation reduces accident potential and ensures brazing is performed safely in confined or complex mechanical environments. Question 26. Through the lens of psychrometrics, Thompson is analyzing HVAC system performance. Why is understanding humidity ratio and enthalpy crucial? A. They are optional metrics for aesthetic comfort. B. They determine both sensible and latent load requirements for optimal system efficiency. C. They replace temperature and pressure monitoring entirely. D. They serve primarily as historical data records. Answer. Correct answer. B. Explanation. Humidity ratio and enthalpy define air moisture content and energy content, directly influencing latent and sensible cooling heating loads. Accurate calculation ensures occupant comfort, prevents mold growth, and optimizes system efficiency. They complement rather than replace temperature and pressure monitoring. ASHRAE emphasizes that psychrometric analysis is critical for proper system sizing, energy optimization, and maintaining indoor air quality. Miscalculations can lead to improper system performance, high energy consumption, and unsatisfactory thermal comfort. Question 27. During the process of tool inspection, Mr. Brown notices a pressure gauge with a bent needle before charging a system. What is the safest action? A. Use the gauge carefully anyway. B. Remove the gauge from service, tag it, and replace or repair it. C. Cover the needle and use it temporarily. D. Only use for low pressure measurements. Answer. Correct answer. B. Explanation. Defective measurement tools can give inaccurate readings, leading to overpressure, leaks, or system damage. Proper inspection ensures that instruments are calibrated, structurally sound, and safe to use. OSHA and HVACR best practices dictate tagging out damaged tools until repair or replacement occurs. Temporary fixes, selective use, or ignoring defects compromises safety and system integrity. Pre-use verification and maintenance of all diagnostic tools are critical to safe, reliable system servicing, reducing the risk of accidents or equipment failure. Question 20. Given the circumstances, is Lopez performing CPR a coworker in a room with refrigerant fumes? Which is the most appropriate immediate step? A. Begin CPR immediately without considering environment. B. Remove the victim from exposure, ensure scene safety, and assess airway, breathing, and circulation. C. Attempt to move the victim while inhaling fumes. D. Only ventilate the room and delete CR. Answer. Correct answer. C. Explanation. First responders must prioritize scene safety to avoid becoming secondary victims. Toxic refrigerant exposure can impair judgment, cause hypoxia, or worsen the victim's condition, safely removing the victim from hazards, providing PPE if needed, and assessing airway, breathing, and circulation ensures effective CPR. Ignoring exposure or attempting care in unsafe conditions increases risk for both rescuer, patient. OSHA and NFPA guidelines emphasize hazard mitigation, safe patient handling, and immediate medical activation in chemical exposure scenarios. Question 29. From multiple perspectives, Mr. Patel is about to service a rooftop unit during windy conditions with unsecured panels. What procedure reduces risk? A. Ignore wind and focus on task completion. B. Use fall protection harnesses, secure panels, and monitor environmental conditions. C. Lean ladders against unit panels without anchoring. D. Complete work quickly without securing loose components. Answer. Correct answer. B. Explanation. Rooftop service exposes technicians to fall hazards, environmental challenges, and loose components that can cause injury. Fall protection harnesses attached to certified anchors, securing panels, and continuous monitoring of wind and footing mitigate risk. OSHA requires hazard assessment and use of PPE. Leaning ladders or rushing increases fall likelihood and can damage equipment. Proper planning, securing equipment, and adherence to rooftop safety protocols protect workers, comply with standards, and minimize accidents during maintenance. Question 30. Through careful analysis of refrigerant exposure incidents is Edwards encounters a coworker who has fainted after inhaling refrigerant. Which action aligns with best first aid practices? A. Leave the victim to ventilate the area first. B. Remove the victim from exposure, assess airway and breathing, and call emergency services. C. Attempt to stand the victim immediately. D. Only fan the area without further intervention. Answer. Correct answer. D. Explanation. Acute exposure to refrigerants can result in unconsciousness, respiratory distress, or hypoxia. Immediate removal from contaminated environment prevents further harm. Assessing airway, breathing, and circulation while activating emergency medical services. Follow standard first aid protocols. Moving a victim improperly or solely ventilating without care risks worsening the condition. OSHA and first aid guidelines highlight hazard assessment, victim stabilization, and timely intervention to prevent secondary injuries and ensure the victim receives appropriate medical attention.